Okay, so introduction of our speaker. We are so lucky today to have one of our great community leaders here with us. Julie, let's put her bio up. So Julie Van Domelen is the CEO of EFAA. She is the former mayor of Lyons. She's clearly a glutton for punishment. The senior economist and social protection specialist for the World Bank. She has an MPA from Princeton and a BA from Colgate, International Relations. So Julie, come on up and tell us all about EFAA and the study. And here's your clicker.
So, thanks. Thanks, Chris. It's nice to be back at Rotary. I was a member for about a year. I saw Marty and other people that helped onboard me, and then realized you are so committed and do such work that there's no way I have time for this. So this is when I retire, you'll see me again. I'm also a Rotary legacy. My dad was the president of the Aspen Rotary, and from his office, I have those 4 points framed. They're in my office now. So I think it's just a great set of rules to live by. So I'm happy to be here today to talk about, are we moving towards a community where everyone can thrive? Rotary, I know if you're in this building, you care about our community deeply. It's one of the truly great civic organizations. So I feel like I'm among like-minded, and I want to share with you what we're seeing at EFAA. So let's see if I can get this right. Okay. So first, just one little bit about EFAA. I know we're well known in the community, but not everyone knows us or knows everything that we do. So the Emergency Family Assistance Association, which is why we use the acronym EFAA, has been in the community for more than 100 years. It actually started with the Spanish flu. So echoes of our last few years with COVID, when religious organizations, women's groups, civics groups all got together to figure out about how to get neighbors to help neighbors through a very difficult time in 1918. And EFAA's been in the community since that. We are a community-based safety net, which means that almost 100% of our funding comes from Boulder County. And more than half comes from individual donations. So we really are of all of you and depend on all of you. We are a family resource center, which means that we support low-income families with a lot of their needs. And we are one of 3 in Boulder County. So EFAA serves the city of Boulder, the mountains, and around that area. Sister Carmen out in East County, and then the Hour Center based in Longmont for the St. Vrain Valley School District. And the 3 of us cover the entire region of Boulder County. We can pretty much finish our sentences, and we provide similar but not identical services. EFAA's core programs, we serve about 7,500 people every year. That's about 7% of the population come through our doors. Our food bank distributed over $1.5 million of food to people last year. We also have a very strong basic needs program for people that can't make ends meet. That's largely rental assistance. It's also utility, medical, dental, transportation. And it comes with wraparound services. So if you come in through our doors, you meet with a navigator. Not only are they there to help you with that month's rent, but they're also looking at your budget, looking at other referrals, looking at other ways of helping you. So it's a more comprehensive support. We are also one of the few agencies in Boulder County that actually provides housing for families with children that are going through homelessness. That's part of the homelessness equation that's not talked about very much, but we have a serious problem of family homelessness in Boulder County, and we have 67 apartments on 8 housing sites in the communities listed there. We also provide emergency hotel vouchers for families with kids that are sleeping in their car or in dangerous situations. Beyond that basic needs, we also have economic empowerment, we call it. It's how do you help people not only meet today's needs, but not need EFA in the future, how to become more economically resilient. We focus on financial health courses and digital divide courses with partner agencies and provide employment supports to the families that are living in our temporary housing, because they're going to have to move on and they're going to have to be able to afford rent in our community. So we also have a children, youth, and family program that provides everything from support, extra support for the kids that are living in our housing that have been displaced and are going through some pretty stressful times with their parents. Make sure they're linked to school resources. We do childcare referrals, and we fund summer camps for those kids. So those are our basic programs, but we also do what we call strategic education, and that's why I'm here today. So our EFA Strategic Education Program, and we actually have a member of our Strategic Education Committee who was for years, Leslie Durgan's here, so if I get anything wrong, she can correct me. We seek to increase community awareness of the key issues that face low-income residents in Boulder County. We also seek to give voice to EFA participants on those issues so they can directly speak to their lived experience in our community. And we share our knowledge and experience with, to impact public policies and legislative items that can benefit EFA participants and improve the general conditions of the community for them. So that's our strategic education program. One of the kind of outputs of that program, we now have done it 2 years in a row, we'll do it every year. It's called the Community Wellbeing Dashboard. I have a Spanish, I'm gonna put some up front and you're free to take them if you're interested on your way out. I don't think I have enough for everyone, but also they are available, these are available on our website to download and print if you're interested. So why did we do this? Well, what we've realized is that there's lots of different boulders. You know, we talk about, you know, kids that were homeless and they're like, well, that doesn't happen here, to someone that just doesn't intersect with that world. And we felt that it was important for us to share with our community what we were seeing. In a way, we are the canary in the coal mine. We're one of the main safety net organizations. We're trusted. We've been here. We're deep roots in the community. And we feel it's our obligation to tell you and share with the broader community and people that are community-minded what's going on in our community. So this is the Community Wellbeing Dashboard. It's got a lot of kind of graphs and stats and everything, but I'm going to just do some high-level findings from this year's Community Wellbeing Dashboard to share with you. So we look at the aspects that are kind of most important for the folks that we serve. That's poverty, housing, income, wages, health, food security, those kind of issues. And I have to say 2023 was disheartening. Most trends got worse and significantly worse. So we have been speaking out on what we're seeing. First off, poverty is growing in Boulder, particularly compared to pre-pandemic levels. In fact, if it's now, you're more likely to be a child living in poverty in the city of Boulder than in the state of Colorado, which is just shocking if you think of our wealth and kind of wonderful life that we have here. The poverty rate increased 13% above pre-pandemic levels. And there's about 5,000 more people living in poverty after the pandemic in Boulder County than before the pandemic. The pandemic had a huge impact on lower income households. Employment and wages, about a quarter of households in Boulder County don't earn enough to make ends meet without public or private support. That's from the self-sufficiency report that the Colorado Center for Law and Poverty does. And it has huge implications for everything. How much affordable housing do we need? How many people are coming through the doors at EFAA? That's a big number, 25%. It falls particularly hard on children. The number of kids living in poverty in Boulder County is about 5,300. And I think more than anything that bothers me, in my heart as a mom, and in my day watching families struggle through this, is homelessness of families with children. In last school year in Boulder Valley School District, there were over 800 children in BVSD that were registered as homeless. I don't know if people know that? To me, it's still shocking when I say it in my outside voice. To give you some context, when I started at EFA 10 years ago, that number was about 500. And through a lot of really aggressive rental assistance, scaling up prevention programs, making sure people didn't get evicted when they just couldn't make 1 month of rent, that amount went down to about 300 kids. That was in 2019. There was a blip when the Marshall fire, but the base was about 300 kids. That's still a lot, but we were trending in the right direction. It was almost 900 last year in BVSD. Individual children going to school that do not have a fixed place to live. Where are they? Most of them are doubled up in couch surfing, which is what we would all do if we lost our housing. We would move in with relatives, friends, we'd find a safe, we don't first go to the car, right? We find a place to crash. They're either living in our housing or they're in a domestic violence shelter. What causes family homelessness? About a quarter of the cause is changes in the household structure. So that's domestic violence, divorce, death of a spouse. Something changes in what was sustaining that household. But 3/4 of the time, it's just economics. Got my rent raised, got my hours cut, my kid broke their arm, we have a huge medical bill. With family homelessness, it's much more rare, the addiction and mental health issues that you see in the adult individual homeless population, because they still have their kids, most of them are working, and they're holding their families together by the skin of their teeth. Other areas that have worsened, this is not a really great uplifting lunch discussion, but it's the reality of what we're living in. Food insecurity is up 14% from the previous year, so there's over 32,000 people that feel food insecure, everything from hunger to just worrying about whether they're gonna be able to afford the groceries this week. And that makes sense because we've all seen food prices increase, and they've increased a lot more than wages. So we can all imagine how that happens. Housing in Boulder is increasingly unaffordable. I think that's been said in every study, every document for probably 30 or 40 years. But more and more people are losing their housing because of it. So the average family at EFA spends 70% of their income on housing costs, just to keep a roof over their heads in our community. And they're working, and they're probably coming into the food bank to get some additional help. Every once in a while they can't afford that rent, so they may be coming in for a month of rental assistance, but they are right on the edge. They can't really afford anything else. Evictions have more than doubled in the last year, and once you have an eviction on your record, it's very hard to lease up again, so it has some long-term effects. So we've seen a year that has been distressing for us and for a lot of people in the community. So what are the implications of this? One is the day-to-day strain on the safety net. We've seen numbers of need that we've never seen in Boulder before. And this is not just EFA, it's true of almost every safety net organization out there that you talk to. Just to give you a kind of orders of magnitude idea, and this is largely from the inflationary impact of the last year, particularly in housing, childcare, food. EFAA's food bank, kind of right before COVID hit, we served probably 350 households a week come through our doors to get supplemental food. It didn't go up that much during COVID, a bit, but there were a lot more supports out there. People got other forms of assistance, so we didn't see a huge spike. But then when those forms of assistance were peeled off after COVID and then food prices went up, we saw a wave of people needing food assistance to the point where went from 350 households a week to 750 households a week. And we were trying to find food. We were running out of food. We've had to shift. Used to be you could come weekly. Now you can come twice a month. It has been a huge strain. Same thing with rental assistance. Same thing with across the board need. The other impact of this is just more people are in crisis. And this is not really widely understood in the general population because it's concentrated in lower income households. Even I go fill my car up and I'm like, oh, I'm paying more, but I'm not driving. I'm not able to get to work. So it falls differently across all of our neighbors, and friends, and family, coworkers. And there's a segment of the population that is deeply in crisis. They are scrambling, they're losing housing, they're doubling up. As a result, and this is important for our whole community, it is increasingly difficult to afford raising children in Boulder County. BVSD is projecting declining enrollment. The number of 0 to 5-year-olds in Boulder County went down twice as fast as the state level went down between the last two 10-year censuses. It's hard to get childcare, it's hard to afford housing, and it is particularly difficult for employers to attract and retain lower income workers here. So we see it across the board. It doesn't just affect the safety net, it affects employers, it affects schools, and I'd like to give you the slide of all the easy answers. I don't have them. We're doing as much as we possibly can to stabilize the situation, but we actually need all of us in the community to put our heads together collectively and figure out community level strategies for addressing this imbalance that our low income households are facing right now. So that was a really cheerful presentation. But I can say the canary is not dead in the coal mine yet. We are chugging away. People are finding strategies to survive. But I think it's important that we all know exactly what's going on in our community so we can begin to address it. That's all. Wait, I think I have one. Yeah, smiling faces.
Questions?
Nice. Yeah. Do you foresee in the county of Boulder there to be regulated rental prices? I could see that happening, but I wonder if that's a discussion.
Like rent control type regulated rental prices? Yeah. That's, I believe it's not legal in Colorado. I know that there's been people pushing against that. But no, I think the strategy that's been used is try to increase the permanently affordable housing stock through investments in affordable housing. But we do not see or anticipate any changes in rent laws statewide. I don't know if anyone else knows more about that. All right? Okay. Yeah, it's illegal in Colorado.
Julie, thanks for coming to speak with us, and thanks for everything that you're doing. It's really encouraging, even if the numbers don't look so great. I'm curious, just given the volume of people that are experiencing homeless against the 67 units that you all have available, How do you approach that? How do you decide who gets to stay there, how long they get to stay? Could you speak to that a little?
Yeah, we don't have a wait list. What we have is called a priority list. So we kind of triage. So if it's a mom with a newborn in a car, we are going to try and find the first available unit. If it's a family with kids that are doubled up in a apartment or mobile home and they're wearing through the relationships but they can like hang out for another month or two, then they're a little bit lower. If they have young 0 to 5-year-old children, then we prioritize them. So it's a constant kind of, and we actually help people while they're waiting try and find other alternatives. Getting on affordable housing lottery lists. We have a full-time family housing navigator that is picking up information on available apartments and prices and that kind of thing. So we're actively trying to get people housed even before we can house them. The other thing that we're finding it harder is to get people to successfully graduate from or exit our housing. So I think we have an excellent record given how hard it is, but about 80% of the families that exit after we have two kinds of housing. 4 months, short term, 4 months, furnished, free. And then transitional units that are up to 22 months, so that pay about $500 a month. So we have this kind of emergency, quick stabilization, and then apartments that, you work with your case manager on your strategies and referrals and saving money and hopefully exit successfully. So a successful exit for us is someone that is able to leave EFA housing and find safe, in other words, not your car, not doubled up, safe, adequate, affordable at 50% of your income housing. And about 80% of the families that come in homeless exit to successful exits. But it's not 100%, and it's a challenge. There were some hands up back there.
Obviously, the challenges are great, and you appear to be meeting them. My question is quite different. What about your own personal job satisfaction? How does it feel today versus, say, 10, 20 years ago when things were a lot calmer?
I spent 20 years working for the World Bank in Africa and Latin America, so I love my job. This has been a passion of mine. I grew up in Aspen, actually, so there's probably something in psychology about why I worked on poverty for the rest of my life, but it's been my passion ever since I went to Africa out of college. So I have deep satisfaction because I'm trying to improve the situation. Like if any of you, engaging helps, even if you can't fix everything. So I not only love my job, but I just love this. I think this field is something that's called to me. So I have a gift that I've had for a long time in my life, a sense of purpose. On top of that, there's a whole bunch of frustration at this age that things have not been so easy to fix. I'm frustrated that we haven't been able to build a more equitable society, and particularly in a wealthy place. When I worked in Africa or I lived in Bolivia, the challenges was just, it's a very low income setting. It's hard to get basic needs met in a poor country. But I think that we should do better in Boulder. And I'm probably getting old enough that I'm speaking my outside thoughts aloud more than I ought to, but yeah.
Julie, thank you so much for your presentation and your support of our community. My question is, what are the typical parents that come to you? Are they did they grow up in Boulder? What percentage is married? What brought them here to embrace our community to begin with?
Yep. So we see the people that come to EFA, it's really kind of our homegrown. Boulder is creating these lives. I get asked quite a bit. What about the recent migrants? And I would say that's about 10% of on top of this 90% wave that's coming through our door, because we do see where they're coming. We serve About half of our households are Latinx, so it's higher than the average for Boulder, which is but about for the poverty levels of those, different ethnic groups. But what's interesting is we don't feel overwhelmed by the recent immigrants. It's a very thin layer, and they're kind of moving on. They're finding where they're going to land. So I think most people have been in Boulder for a long time. And in fact, since we've been around for so long, we have people that grew up in EFAA housing and are on our board, or are very successful business people and their parents used to bring them to the food bank. So we have a very deep roots in Boulder. This is, so it's a very much who we serve is all the people that you cross paths with on a given day and may not know that they're in those situations. The housing, we have a significant, but not a majority of single-parent households. But so our majority are two-parent households. I mean, it takes 4 minimum wages to afford, to be like self-sufficient in Boulder County. So if you only have 2 parents and you're only making minimum wage, I don't know how they do it. So, we see all kinds of folks. We also serve a surprising number of seniors that come to the food bank because costs have gone up, their income is fixed, and they've been in the community their whole lives. And it's gotten more and more expensive, and they're trying to stay where they, in their community. So it's a mixed bag.
So I'm curious to know, given the fact that you have this huge increase, what the implications are for your staff. Are you able to see people who are in these dire straits in a timely manner? Are you able to ramp up your staffing so that there isn't a long wait time? What's the story on that side?
So this is the story of our last year. We've really been working on our food bank and our financial assistance about right sizing. So if we hired more people, we just run out of food or money faster, right? So we're trying to figure out new rules of the game. Like I mentioned, allowing folks to come twice a month, not 4 times a month for food. They can take more, but it turns out that it just helps us with the flow, if you will, just being able to get that number of people through. We haven't seen a huge decrease in the amount of food they're taking. They're just coming less frequently and taking more. You know what I mean? Like on the rental assistance side this year, we have had to cut $500,000 out of our rental assistance budget starting in July. We had just because of some funding, some county funding that's drying up, some COVID funding that's ending. And we have changed. We wanted to keep trying to serve as many people as possible, but it also has to be in a meaningful way that helps them solve their rent problem, right? So our answer to that was we have dropped from $1,000 to $800, the maximum amount you can get for a 1-month rent. And that affects about 30% of the people have rent above that. So we've been really, digging into it and trying to figure out how to right size the safety net for the resources and the need. We do not fill the need out there in the community. People have got to figure out other ways, other resources. If we had more money, we'd give out more money.
She wouldn't let me take the mic from Dan, I understand that. Julie, it's Dave Hoover. Suzanne and I have been in, hold it up to your face, Dave. Is that working? Yeah. Sorry. Within the last week, we've been in about 3 or 4 different sets of circumstances, one with impact on education. This morning we were talking to a person at United Way in Denver. And one of Suzanne's complaints is that, we helped them with their early childhood thing that they're doing, which is great. And Suzanne is saying, look, we got a lot of problems up here in Boulder County, and how do we work together? This guy's very receptive to all that. So my real question is two things. One, how's your financial situation to do what you're doing? And secondly, although you don't have the answers, do you have any ideas about any kind of catalytic things that could happen to improve this situation? The other thing I worry about is that, notwithstanding all the happy talk that everybody has, I fear that we're coming in for some tougher economic times here in the next couple of years. Could be wrong, hope I am, but it's going to squeeze those people even further, I fear.
Our situation, our financial situation is pretty solid. We are resetting at a higher level of funding than pre-COVID, but not as high as that very peak of like 2022. And some of these are because COVID resources are going down. It's interesting, for decades and decades, EFA received funding from United Way. This past year is the first time we've been cut, and a lot of organizations in Boulder County were cut, zeroed out, with no explanation except their money is going elsewhere. So we're always kind of reacting and trying to find new sources, trying to find new ways of doing things, and relying on this deep sink of trust that people in the community have of us. As I said, most of our funding, or a big chunk of it, is individual donations. So as people during COVID, we were all in it together. It reminded me of being the mayor in Lyons during the flood. It was the same dynamic. It was a crisis. Everyone banded together. People wanted to help everyone, and let's get through this together. Everyone was affected. And then about a year out or so in Lyons, those at homes were fine, were back in their lives, and the folks that had their homes destroyed were still mucking out and dealing with insurance, and it kind of went in two different directions. And I think that's kind of normal coming out of a big disaster, and I think COVID is similar. A lot of people I'm traveling, I can see my family, oh thank God, I don't have to do the Zoom meetings anymore, we're going here, we're going there. Life kind of returned to normal. But for a lot of folks, they were depleted during that period. These were frontline workers, and then increases in prices have just nailed them. So I'm kind of rambling, I can't remember the question. Second part of the question was, what can we, yep. So what should we do about it? Well, I think, first of all, you have to know you have a problem, right? We hear a lot about affordable housing, but are we actually able to produce enough to address the situation? It's still hard to get any individual housing project passed. People don't want it in their neighborhood. They don't want that use. They want it to be a park. They want it to be, there's a great deal of pushback against affordable housing as well. I think we should just stop that and set some real expectations of, okay, how much affordable housing can we do? What's realistic in terms of funding? And then hold our affordable housing creators to those numbers and see if that helps. But I don't think it'll help the whole way. I am an economist. I don't think we'll ever build our way out of this. I think we have to look at our zoning, how we use land. We have to protect our mobile home parks. Those are the deep sinks of affordable housing where our folks that come to EFA live, a lot of them. EFA has taken a very vocal stance in favor of raising the minimum wage. 10% of the workers in Boulder County make less than $15 an hour. So it's not a ton of people, but those are the people that are coming, that cannot make ends meet. So we take it from a safety net perspective. We think that raising the minimum wage, at least the first steps, will have a noticeable effect on the lowest income households in Boulder. And I know it's controversial, but from what we see, how could we not say that? Other structural kinds of improvements, I think we have to look seriously at childcare. How we permit it, how we fund it, because if you can't work, if you can't get out of the house to work, and it's so expensive, and the very limited slots that are subsidized through CCAP. We lost a significant number of early childhood facilities and slots during COVID. People got out of the business. It was tough to run. It was really hard to run during COVID, and they haven't come back into that space. So I think we need a Marshall Plan, being from the World Bank, on childcare in our community. It's a great investment. It's probably the best investment in our young children in our community. So I think there are things we can do, but we have to all agree to do it, or at least enough of us.
Well, Julie, I want to thank you so much for coming today and for your time. Although the numbers and implications are troubling, as we saw, I think the assistance and resources that EFA provides are truly changing the lives of people in our community that need the help. As someone who moved to Colorado probably a lot sooner than a lot of people here, it's nice to see where we are now and where we can go in our future. Specifically, child homelessness. Working at the Children's Hospital, we often see a lot of families that are going through child homelessness as well as treatment. So it's nice that they have these resources to go to. As you also know, with your time in Rotary, Rotary is on the brink of eradicating polio, and I'd like to present you with a certificate that Boulder Rotary Club has contributed 100 doses of the polio vaccine in your honor.
Thank you. That actually means a lot to me. I lived in Bolivia. One of my roommates had grown up with polio and had, you don't see it in our community anymore. So yes, I really appreciate that. You. I think I have.
You leave those up.
Yeah, some are in Spanish and some are in English. I'll let you pick it out. And okay, here you go.
Come on down.
Thanks.
I want to thank Julie one more time.